Curvilinear transducer with a musculoskeletal exam type is used to perform an ultrasound-guided erector spinae block. The examination can be performed with the patient placed in a sitting, lateral, or prone position, with the examiner standing at the patient's side. Erector spinae blocks in the lumbar region can be more challenging due to the increase in depth needed to perform the block, especially in the prone position. The transducer is placed in the lower neck lateral to the spinous process in a parasagittal plane, with the orientation marker directed toward the patient's head. The transverse processes of the T1 and T2 thoracic vertebrae can be seen as hyperechoic rounded structures that are covered by the hypoechoic paraspinous muscles. There are 3 muscle layers in the thoracic region. The most superficial muscle is the trapezius, which is seen as a hypoechoic striated structure. The rhomboid muscle lies just below the trapezius and is separated by a thin hyperechoic fascia. The erector spinae muscles can be seen as the deepest muscular structures in this region. The transducer is slowly moved caudally, and the rhomboid muscle can be seen to taper at the T7 level, which helps define the thoracic vertebrae. As the transducer is moved more laterally, the rib can be seen as a round, hyperechoic shape that connects to the flatter transverse process of the vertebrae. The target for an erector spinae block is lateral to where the muscle is attached to the transverse process. The pleura of the lung is seen as a hypoechoic line between each of the thoracic processes with the lung below. Once the desired level for the block is identified, the needle is introduced in an in-plane technique through the paraspinous muscles in either a caudal to cephalad or cephalad to caudal direction, aiming for the transverse process. The needle is slowly advanced toward the transverse process through the 3 muscle layers and deep to the erector spinae muscle. Once the needle tip touches the transverse process, it is slightly withdrawn and local anesthetic is injected to hydrodissect the erector spinae muscle away from the transverse process. The local anesthetic spreads both caudally and cranially, completing the block.